I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them. I didn't want anyone to know I couldn't read.
We had a child that was physically handicapped that I had to do physical therapy on. I would show up on Tuesdays instead of Thursdays for the appointment. I would be exercising the wrong side of the body.
I had an abscess in a ear one time. Well, I had to fill out forms and I couldn't fill out, so I didn't go. I come back home. I ended up having to go to the emergency room that night because it burst.
Health literacy is the ability to read, understand, and act on medical information. Unfortunately, millions of adult Americans lack adequate health literacy skills. The doctors, researchers, and patients in this video are real, not actors. The situations, frustrations, and complications are also real. Nearly half of Americans have health literacy challenges. Odds are some of them are your patients.
Can you imagine what it's like, you being a patient and sick, and you know that you have limited skills, okay, and you're talking to an intelligent doctor like yourselves, and these people are using words that you really don't know because they're not speaking in layman's term, okay?
Right.
Most doctors are just presuming that everybody's intelligent as they are, and that is just not the case. So what you do, you come out of that room, that examination room, with this intelligent woman or man, thinking, God, I hope I don't make a mistake with my medicine, because I did not understand anything he or she said to me.
The heart of the problem is a disconnect between patient ability and healthcare communication. The average American reads at an 8th grade level, but healthcare information is often communicated at a college graduate level. This disconnect leads to confusion, frustration, and a feeling of helplessness for patients and physicians. While healthcare information can confuse even highly educated patients, those most vulnerable to misunderstanding are the 1 in 5 adult Americans who are functionally illiterate.
Take one capsule.
That's right. One capsule.
One capsule. I don't know what this is.
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on there telling you how to take it. It say take it twice daily, but it don't say what time to take it.
For people with limited literacy skills, the world can be a challenging one. 21% of adult Americans can't read the front page of a newspaper. 48% can't decipher a bus schedule or make sense of a bar graph. The problem is even worse in the healthcare setting, where emotions run high and vocabulary is unfamiliar.
Based on our decade of research on health literacy, our research group has documented clearly that patients who have inadequate health literacy are more likely to be hospitalized for their chronic illnesses. And this is regardless of their socioeconomic status, whether or not they have a primary care provider, regardless of how ill they are.
Can you tell me which one is which and what you take them for?
That looks like my medicine that he gave me for the morning. I take that and the little pill that... So this is this is Lipian, isn't it? Yeah, that's Lipian.
Okay. And what do you take that medicine for?
Don't ask me. He puts me on there, and I just take it.
Okay.
Anything he tells me to take, I'll take it.
Okay. So you trust him?
Oh, you better believe it, my life.
Research has shown that many patients have a hard time understanding basic medical instruction. 26% didn't understand when their next appointment was scheduled. 42% didn't understand instructions to take medication on an empty stomach. 86% couldn't understand the rights and responsibilities section of a Medicaid application.